This is a bone scan of someone that's had a knee replacement. So if we look here, this is the right knee here. And what we're interested in is the dark area at the front of the knee, which is indicative that there's increased activity levels in the patella. Now if we move down, we can see as we rotate the image round from the bone scan that the knee otherwise looks like there's low levels of activity around the knee replacement itself. This indicates that the bone turnover, because bone is living tissue, is increased at the front of the knee and the patella. Now this lady's knee replacement has not included a patella replacement, and often when this is the case, sometimes people can get anterior knee pain because the bone is softer in the elderly and sometimes starts to erode into the femoral implant, the metal implant. Now, what this lady went on to do was to have a secondary resurfacing where the back surface of the patella was removed and then a plastic button was cemented in place. This can be done originally at the start of when the procedure is initially done, or it can be done at a later date. The reason some surgeons don't do this automatically is because most times a lot of the newer knee replacements we use are what are called patella-friendly knee replacements, and so the groove or trochlea at the anterior part of the femur where the kneecap runs is replaced with metal. So the knee patellofemoral joint part of it has a half replacement in it when a total knee replacement is done. However, some people go on to get problems with the patellofemoral joint, and there is a small rate of secondary resurfacing. The reason that they give for not doing it automatically when the knee replacement's done is that it's another area that can fail. And I have seen patellofemoral, the patella part of the total knee replacement led to earlier erosion. If possible, it is often better sometimes to try and keep as much normal tissue as possible. So it tends to boil down to surgeon decision. But as I state, this lady did go on to get anterior knee pain. She had a secondary resurfacing, but unfortunately still goes on to get some discomfort around the soft tissues of the knee. We know from the literature that about 1 in 20 people can get soft tissue problems around the front of the knee. Previously, this lady had no issues at all with a knee replacement, and she had had quite high functioning, being able to do all the things she wanted to do. But unfortunately, as she's got older and the knee is now about 6 years old, her balance has started to be a problem and she started to use a stick to walk with. This will have altered her gait or a way that she walks, and this would then secondarily load the knee different, and it may be this that's caused the patella an extensor mechanism to cause to become painful, which is a difficult problem to treat. This is another complication that can occur within joint replacements, in that patients can develop soft tissue pain.